Hamjambo, Your Excellencies, thank you for inviting us here today. My name is Brenda Kitaka, and I would like, because I'm standing here on behalf of the National Cancer Institute that's leading the response against cancer, I would like to ask of you to give us your indulgence for just a few minutes, and I will request the following persons with great humility to just come forward with me. Kindly, Dr. Elias Meli, the CEO, National Cancer Institute. Dr. Miriam Mutebi, a breast cancer surgeon at the Aga Khan University Hospital, and the president-elect of the AOTIC, the African Organization for Research and Training in Cancer, and the past president of Kenya Society of Hematology and Oncology. I would also like to request the PS representative, Dr. Martin Sirengo, to come forward kindly. The reason I'm asking for this is because when we were told that we were going to come and represent, I had prepared 100 jokes about running, because I cannot run to save a life. However, I know that today we have 3 technical experts that can give us under a minute things that we need to know about cancer as we prioritize cancer care in Kenya. Kindly, Dr. Elias Mele.
Allow me to greet you in the name of Jesus. Good evening. Our host Governor, Jonathan B., Excellency Governors present, Council of Governors, all dignitaries, all protocols observed. We are humbled to be here this evening to speak to you about what has really bothered most of us. My name is Elias Meli. I am from Uasin Gishu County, and I'm glad to be home. Thank you very much, Uasin Gishu County, for granting us this opportunity to share with you in 1 minute. We are the National Cancer Institute of Kenya, mandated with cancer prevention and control. We are here to give you hope. We know that we are going through a very difficult times in our health, and we are here to encourage you that this disease which has terrorized us physically, economically, socially, and spiritually, we have been mandated to bring it down. We did it with HIV, which harassed us 20 years ago, and it's in control now. I'm not going to take much time. We have our strategies with you that we have shared. We have our branding materials. We will be coming to your counties to support you as county governments. We would want to celebrate devolution in this country that has enabled our health in our counties to improve. We will be coming to each of the 47 counties as National Cancer Institute of Kenya to develop county cancer action plans so that you can seek treatment from your vicinity. You will not be traveling to India or to Nairobi, far away from home. We are developing regional cancer centers, and I know our able governors here are very happy with that. And we are going to have cancer control centers very close to you. Allow me, with humility, to invite Dr. Miriam Mutebi. She is one of our celebrated cancer specialists in this country in 1 minute. And she's been elected to represent the entire Africa in research training. We are a blessed nation. You know how our president leads by example, and we have many uncelebrated, quiet ones in this field. Welcome, Dr. Miriam Mutebi.
Thank you so much, Dr. Meli, and Your Excellencies, ladies and gentlemen, Chamugui. I want to talk very briefly about one of the issues that I think is close to all our hearts, and that is health. We know that we've all been dancing here and really having fun and celebrating, but then really thinking about that quite enough for the longest time, and many of our patients had very little to dance and smile about. And why is that? That's the reason is because we are seeing an increase in the number of patients who are getting diagnosed with cancer. And what we've been seeing is that not only are we patients diagnosed late, they frequently do not complete their care. And if we do a deeper dive into the reasons behind this, we find financial factors, the fact that patients have to pay out of pocket, which has been mitigated partly by the NHIS, the fact that patients in Kenya will see on average 4 to 6 healthcare providers before definitive diagnosis of their cancer is made, and the fact that things we don't talk about, the fact that we are many different cultures, social-cultural barriers such as stigma, collectivism, that all translate into poorer patient outcomes. However, this is not a message of doom and gloom, it's really a message of hope. How do we work together? I always say I'm in the hope business, and I think really part of the strides around that have been changing narratives around cancer, and how can each of us here change the narratives for our cancer patients? The first thing is we are seeing an increase in the number of cancer facilities, centers of excellence. We're now having a vibrant national cancer institute that's really leading the charge in how to support care, but we've seen an increase in the grassroots advocacy around how do we work together collectively to become our brothers keepers in order to improve care. So in summary, I would say let's work together thinking about the patient journey, whether it's the cost of care, which is a real thing. Let's work together. We're not just looking at siloed approach. We want to see how do we get everyone to the table? How do we manufacture our own drugs? How do we manufacture our own expendables? We are currently paying 3 to 4 times the same cost for a cancer drug than anywhere in other countries. That is unacceptable. We are currently having to manufacture and import our cancer implements. So how do we work together? How do we get the manufacturers? How do we get the financiers to work together with us all to change narratives for our patients? Thank you.
Thank you, Dr. Lee. I would like to invite Dr. Martin Sirengo, who is representing the PS Health. Thank you.
Thank you. Your Excellencies and all protocols observed. My name is Dr. Martin Sirengo from the Ministry of Health. I'm representing the PS Medical Services, Mr. Hari Kimtai. I was asked to speak about what we are doing to assist in cancer control in this country. And when I was coming here and I saw the people seated here, I kept wondering, are people ready to listen to this when probably, and my co-speakers, the only people between you and the dinner. But I would like to thank the organizers of this event, first for putting up entertainment, because one of the things that we must do at an individual level and family is exercise towards prevention. Now, why is cancer so important? And I would like to ask a question here. How many of you have been affected or know somebody who has cancer in the past 2 years? By show of hands. The number is huge. And even if you've not been affected, I am sure you have been a member of a WhatsApp group to contribute money to support someone who has cancer. And therefore, cancer is such an important agenda in the national government as well as counties. We're working together. And for us to be able to provide the services, we have put in place policies that guide our cancer control response. We just finished implementing the 2017-2023 cancer control strategy that had key pillars in terms of cancer response. The first one being aware, primary prevention. Being aware and doing things that will prevent us from getting cancer because of the many risk factors that we know. Infections, sedentary lifestyles that we have, nutrition, sources of water, and all that. Number 2, early detection. Distinguished guests, the unfortunate thing about cancer is that by the time someone goes to hospital, chances are that they are already advanced. In this country, we have over 40,000 cases every year. More than half of that die eventually because 7 out of 10 cases that we see come when it's already too late. And so early detection means that we need to get the initiative within ourselves to go for screening, to do things that will keep us healthy. And we have partnered with counties to make sure that the low-level health facilities through the primary care networks are going to be equipped. Some are, of course, have been equipped to provide those services for screening for cancer services. Just as basic as taking your blood pressure, your weight, and all that. Number 3, treatment. Dr. Meli talked about us setting up centers of excellency for cancer treatment. Of course, we have the national referral hospitals, which are the hub for cancer response, but we are also setting up the spokes, which are the regional centers. In the first phase, we have managed to set up Garissa. It's now functional. Mombasa is functional. Nakuru is functional. The next center that's going to be constructed is Kisii, and others will follow. And of course, that will supplement what the level 6 hospital like MTRH here, the KU referral, Kenyatta doing. And lastly is the issue of palliative treatment and supporting people with cancer. Cancer comes with a lot of stress and affects families to the level that some of them have been able to sell everything. And therefore the level of mental illness around cancer is a real issue, and we need to address that. And for us to do all these things, we must have the right equipment, the right infrastructure, we must have healthcare workers who are able to provide these services, and for all the things that we do, we must monitor, we must measure. And lastly, we must invest in research. And together, I think we'll be able to fight this cancer problem. Thank you.
Thank you so much. I think the one component that was left out, and I want to appreciate all the speakers, is the community. And I stand here representing the community. The people you raised your hands and said they have been affected by cancer, the people in the households that you're taking care of, and the people that we want to help to prevent. 2 messages. The first one, we have a vaccine in this country that's targeted at girls who can prevent cervical cancer, and yet it's the leading cause of cancer death in Kenya. And the uptake of that vaccine is really dismal. So we have to do something as communities to understand there is one cancer we can beat. And my ask of each one of you is, when you live here, when you leave the land of champions, be a champion in your community to get girls to prevent cancer. The second message, and this goes to all of us who fear talking about cancer. It's a weighty matter. It's something that should not be taken lightly. But we have people in our communities who have lived experience. They have gone through treatment in Kenya, they have been taken care of in Kenya, and they are living examples that you can live and thrive beyond cancer. Let us equip them so that they become the last mile to reach the community with the knowledge that there is life beyond cancer. Your Excellencies, allow me to recognize the board of NCI. Kindly just stand up so that people can clap for you. That's part of the representation that's leading National Cancer Institute in leading the response against cancer, and the staff members who made this possible. Kindly stand up. Now, I would love to spend more time and tell you about the 100 jokes that I had you may see, but time is not on our side.